also very, very, very supportive right now of vaginal microbiome testing. I think that BV specifically is something that is surprisingly can be asymptomatic, even though as women we are told, it's like if you have a fishy smell, if you're noticing watery discharge. I think that there's biofilms that are forming that are just very, very prevalent and kind of tricky to kill off. So getting that vaginal microbiome testing definitely had issues in my last pregnancy. I could not kick BV for the life of me. I had to do, unfortunately, so many antibiotics that I really did not want to do. But for me, I had my son, my first child. Um, I had him early, so preterm labor, and I really think that was a strong part of it, of going into labor early. And I just, with my history of loss, was like, this is the price I'm going to pay to stay pregnant and make sure that this factor is not going to affect me. So I do think that it is more prevalent than we realize and playing a role in recurrent loss.
In today's interview, I had the pleasure of speaking with Carrie Cannon. Carrie Cannon is a functional medicine certified health coach specializing in fertility. Carrie helps individuals and couples dealing with unexplained infertility, recurring pregnancy loss, and confusing lab results find answers beyond what standard care provides. Drawing on both advanced functional lab analysis and her own journey through years of infertility and loss, Carrie bridges the gap between conventional medicine and integrative approaches. Her work empowers clients to understand their bodies, advocate for their needs, and feel more confident in their next steps towards building a family. In our interview, Carrie and I spoke about patterns, labs, or symptoms to look for that might correspond with recurring pregnancy loss and/or infertility. We also spoke about the most common root causes of recurring pregnancy loss and what sort of interventions Carrie uses in practice to support her fertility-focused clients. Lastly, we spoke about some helpful testing Carrie often recommends in practice to her recurring pregnancy loss and or fertility focused clients. Now on to the interview. So I am joined today by Carrie Cannon, who I'm really excited to have this conversation with because this is a absolutely fascinating topic. And unfortunately, in the endometriosis population, infertility, subfertility, recurring pregnancy loss, complicated fertility cases are unfortunately very common. And so, Carrie, I thought maybe we could just start with an introduction. Who are you? What makes you a great person to talk to about this collection of topics?
So I am Carrie Cannon. I am a functional medicine certified health coach, and I specialize in fertility and specifically complex cases that don't really have simple, clear-cut answers, as well as recurrent miscarriage.
Amazing. Okay. Right to the point introduction. I love it. So when I was kind of going through your content, going through your like the information that you provided me with, one of the descriptions for your services, looking at charting, looking at labs, looking at patterns to kind of decode what's going on beneath the surface in somebody who may be experiencing recurring pregnancy loss or like a difficult fertility case. Could we talk a little bit about, what some of those patterns might look like?
Yeah, yeah. So, um, so with charting, right, I'm kind of looking for patterns. We always tell all of our clients, we're looking for um, not at the individual tree, but the forest.
Yeah.
So, some of the things that I'm looking for is a slow BBT rise, for example. I'm thinking, what's going on with ovulation, what's going on with egg quality. Is the corpus luteum healthy? Why is there not that nice dramatic jump that we want to see on that chart? Anecdotally, I don't really have a lot to kind of back this up, but with slow BBT rises, we just see in a lot of our clients, those are our clients who are pretty burnt out on their fertility journey, which is pretty interesting to see that common thread. So we're always looking for that. Spotting before period, we're looking, there I'm thinking endometriitis as well as endometriosis, as well as especially after your period as well, that spotting when it comes back. Short luteal phase, of course. I feel like that's the hot topic with progesterone and all of the things. But for that, I'm really thinking, what's estrogen doing? It's not just progesterone. Is there truly estrogen dominance? Which to me means a variety of things. It's not just, low progesterone or high estrogen. Erratic cycles I'm also looking for. So, kind of what's the thyroid doing? Is there some PCOS factors involved? How are they doing with, sleep, alcohol, especially close to bedtime, stress? Basically, like, why is that wonkiness happening? What is the brain and the ovary connection? Is there some interference there? Consistently low temps as well. A lot of times I've been finding, especially lately, like with Temp Drop or some of these other apps, or even, the standard oral BBT, are you really taking your temperature correctly? Is it truly low? Or do we have, a thyroid issue, for example? So those are kind of like just the charting things. And then I like to layer those on top of, what are your symptoms? So really getting that deep intake. And we have like a whole quiz that we call our root cause quiz, but it's really a symptom questionnaire. And so learning about, your cycles. Are there heavy bleeding, clotting? Do you have symptoms of anemia, for example, estrogen, progesterone imbalances? What's your gut symptoms like? Bloating, constipation, reflux, adrenals, thyroid. We're trying to check in on your energy, as well as your nervous system. Is your body perceiving maybe some of your lifestyle choices as threats and therefore kind of having, a stress response to them? And then a big one, immune. I'm always looking for immune factors. So allergies, hives, histamine symptoms, recurrent infections. Even, if you're that person who's getting every little bug that goes around, we're definitely really interested on that. And then on top of that, the the charting, the symptoms, that's when we look at labs, and that's when we're kind of looking at all of the different things to kind of piece together. Everything that I just mentioned makes me think a couple different things. But when we pair it all together and add in the labs, like, what is the common thread between all of it? Because as women, like, we fluctuate a lot. So, one chart can be a little wonky. One symptom can be kind of strange, but they can be transient. So we're looking really for that common theme, and that consistent trend to see, what's really going on here. Where does the body need some extra support to kind of help either regulate your cycle, reduce your symptoms, or try and overcome, something a little bit more complex like miscarriage or recurrent loss?
I love that. Oh my gosh, that was such a comprehensive answer, and there's so many things I would love to say in response to that. Um, you mentioned in the beginning, like you don't really have like data to back this up. Like anecdotally, you're seeing
Mhm.
the kind of slow progesterone rise or low temps in the luteal phase correspond with burnout. I think there's absolutely a science-backed explanation for that, right? Because progesterone will not be strong when your cortisol is elevated, right? We know that your resources, your body's either shuttling those resources towards cortisol production or progesterone. And so often when you're stressed and burnt out, your body's going to be shuttling more resources towards cortisol at the expense of progesterone. So just for our listeners to understand that connection. And I know you know that obviously, but I think it's absolutely, I think science backed, right? That slow rise in temps. Um, Amazing. And I'm loving everything that you're hearing. I see a lot. You made the comment about like the kind of getting sick often. I find too in endometriosis specific cases where, you've got that like immune dysfunction component where parts of your immune system are overactive. And so sometimes I see quite the opposite too, right? Where it's like somebody who never gets sick, they're like really tough and they're super resilient, but beneath the surface, that could be indicating that there's, some crazy high natural killer cells, or that inflammatory reactive branch of your immune system is much much stronger than that calming branch of your immune system. So all really really fantastic root cause issues to be looking into. I'm curious, Carrie, and I don't know if this is a simple question to answer, and I know that everybody is different, so there's obviously a lot of nuance here, but I'm curious if there are like some pretty specific patterns that you see consistently. Do you know what I mean? Like, yeah.
Yeah, so the answer is yes. I think The biggest one that we see in our clientele is actually nutrient depletion. That is just having a total cascade. Or you know what? I actually going to change my answer. It's just depletion. So that can be so many different things. So there's nutrient depletion, of course. Does your body have the right nutrients that it needs to do the functions that it needs to do properly? If it doesn't have those key ingredients, you can't bake a cake without the ingredients. You're not going to have, whatever it is that you're looking for, whether that's healthy cycles or a properly functioning immune system, et cetera, et cetera. Then, there's the depletion of energetically. I think that's more of a nervous system kind of issue. So, are you just giving, 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 going, 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 taking on all of these daily stressors, and just kind of pushing through? Because as women, we can do it all, but we shouldn't be doing it all. And the way that translates into my fertility clients is they are consuming so much of this information and really just trying to advocate for themselves because they don't feel supported by their medical system or their care team. And they're just trying to get better answers and figure out what's happening in their body. So they're consuming, 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 trial and erroring, all of these things. And they're just burning themselves out, in a sense. So I would say that's definitely a form of depletion. We also see, in the more getting to the more complex issues, definitely thyroid. A big pattern that I'm seeing, and which applies to me and my story as well, is my thyroid was pretty good, and I didn't really need thyroid medication. Got a little wonky, so my PCP said, I know you're trying to conceive. Let's throw it on. Let's just add some T4 medication. But it's fine pre-pregnancy, but in pregnancy, it just goes wonky. And it happened again to me, even in my pregnancy, my most recent pregnancy that I did, have after my miscarriages. Right around the time where I was having recurrent loss, which is about 15, 16 weeks, my thyroid, even on medication, my TSH shot up randomly. No idea why. So I think that there's, some I think that there's a reason to be supporting thyroid beforehand and then keeping a very, very close eye, especially if you have, any sort of immune issue that you know of, or recurrent loss, or even one loss, or even just a suspicion. I always tell my clients, like, whatever, if you feel that maybe your thyroid needs support, I love that intuition. Let's trust that. Let's test, why not? So, thyroid's another one. Like you mentioned, immune, and both ends of it, the swing of an underactive immune system and an overactive immune system, can be another thing that we're seeing. So is the body, a lot of times I'm seeing mostly immune activation. So, taking a look at their labs and seeing kind of some of those immune markers like really ramped up. Like, why does the immune system feel like it needs to be on the defense right now? And then some of my underactive people who, like you mentioned, never get sick, and they're so happy. They're like, I haven't been sick since high school. And I'm like, it's a little bit of a red flag. I kind of like that reset of a sickness every now and then. It means the immune system's, doing what it should do and identifying issues that it should be. Um, and so that's an interesting pattern because I feel like that one is so complex to kind of tease out, there's so many different ways to kind of support on both ends, underactive or overactive immune system. And then metabolic. So, I don't want to villainize sugar in any way, especially natural sugar. I do think that there's a time and a place for it. I'm more so meaning, on that cellular level of maybe some cellular dysfunction that's kind of fueling inflammation in the body. So when I'm thinking that, kind of like our PCOS girls who maybe have, or even, for me, like I'm hypoglycemic. So I have that reactive hypoglycemia, and that fuels inflammation in my body, which can, just have a downstream effect. So those are, I think, the biggest, as I like to call them, buckets that we're seeing. Um, I kind of don't even consider hormones to be a problematic pattern because I just think that that's the downstream effect. And so when we're looking upstream at what really is causing any of those things, those are my big buckets that I'm looking for.
Yeah, that's a really good point about the downstream for sure. With again, so many things I want to say in response to your response. Like, sorry to bring it back to endometriosis, that is obviously the population mostly that I serve. But
Absolutely.
with endo, we know things like DHA, sulfate, and testosterone, specifically testosterone. I see like an epidemic of low testosterone in women with endometriosis. And I think largely probably because of like the NSAID reliance for pain relief. I know that those two can be connected, but when you have a fertility focus, it can affect endometrial receptivity and follicular genesis. So it is something I'm looking at, but that's a really good point about it being a downstream effect for sure, right? What is your body responding to? Is it just the NSAIDs from the inflammation, or, is it sleep? Is it lack of physical activity? Is it something going on metabolically, right? Beneath the surface. So that's a really, really good point.
Totally.
Um,
It's so fascinating. I actually
yeah.
wasn't super familiar with that testosterone piece, so I love that. And I mean, I can think back to just clients I've seen this week that I'm like was suspecting endometriosis and having that
Mhm.
conversation with them. And testosterone is in fact very low.
Yeah, it's like honestly, it's probably like 95% of
Wow.
my patients have suboptimal or even like flat out low testosterone. It's really common. Yeah, it's a lot of people think estrogen when they think of endometriosis, right? And rightfully so. It is an estrogen dependent condition, but oh my goodness, I could go down a rabbit hole with the importance of progesterone, prolactin, testosterone, thyroid. Like there's something to be said for all of those hormones. So I just want them to get their attention too.
Yeah,
Um,
totally.
I've never heard, like I'm big into like looking at the labs too, and I've never really heard anybody else talk about it like in this level of detail, which is fantastic. I'm so happy to hear it. Do you have specific, maybe if we just kind of look at the immune side, do you have specific immune labs you like to look at? You don't necessarily need to give ranges or anything like that, but I'm just curious if we're looking at the same ones. Like I love to look at a CBC. I like to look at thyroid antibodies, right, with differential for the CBC. Um, I like there's a very like unique pattern with triglycerides and HDLs. If the triglycerides are like abnormally low, the HDL is abnormally high, especially when you can kind of compare it against the patient or the client's level of physical activity and diet and medical history. Are we looking at the same things?
Yeah, yeah, exactly.
Yeah.
I love
Interesting.
differential.
Yeah,
I
same.
get like so bummed if someone has a CBC and then I open it and there's no differential. It's just it's so fascinating to me. And I feel like also on that tune is homocysteine, because it's relating back to methylation, which we know is going to tell us a lot about histamine and things like that, and all the things. Even though we are looking at that more of nutritionally, especially what are your B vitamins doing, and so on and so forth. But I feel like from a functional lens and from an integrative lens, the way that we can piece together these labs, especially like you mentioned with lipids and those ratios and those patterns. I can't tell you how many times clients are like, well, aren't you worried about my cholesterol? Because it's like, 200 and well, here it's, it's just over 200. And no, because the pattern looks great. And there's so many other things in your metabolic panel, for example, that are telling me that's not like a I don't need to spend all my attention here because there's other things I need to be focusing on for more bang for our buck. So yeah, absolutely. That's the same exact things that we're looking at as well, that it's just so interesting, as well as, some of course, the more advanced things that typically PCPs don't run. And maybe you can get a fertility clinic to run, but some of that recurrent pregnancy loss work, the workup that can look for some immune factors, more like the lupus and the autoimmune. And I also really like to kind of make sure, especially with recurrent loss, and with endometriosis, that we're looking at anti-nuclear antibodies, at least getting that tested at some point in your journey. Ideally more than once if you've been at it a long time, let's just check it a couple times because it can change. But yeah, those are my main ones that I'm looking at.
Yeah, I love that. I love that you bring up the ANA marker. I feel like I've heard from a lot of patients like, oh, my doctor won't run it, or the doctor will run it, and then they go down this rabbit hole of like checking for all the various autoimmune conditions, which is totally fair because if you've tested positive for ANA, they're looking for what is that autoimmune condition. But to me, and I don't know if you agree, Carrie, but to me, it's like if that's positive, that's already telling me that something beneath the surface has gone awry, right? Like maybe it's your gut, maybe it's like a nutrient gap, like, maybe it's sleep disruptions after years and years and years of, being sleep deprived or working in a toxic, stressful environment. So, I don't know if
Yeah,
you agree with that, but just having
totally.
that marker is insightful.
Yeah, I'm finding it very, very interesting with recurrent loss too. I have a couple clients where it's positive only when they're pregnant. And as soon as, if they miscarry, it's negative again. And so, I'm in my mind, I'm thinking we don't want to wait until it's positive again. We want to support your immune system now. We want to start doing some of that detective work now so that if it is positive, in pregnancy, we already have some of that foundational support in place and we're feeling pretty strong about it, that we're not scrambling to kind of catch up with it and figure out, oh gosh, like what is happening? What is my body trying to tell me? So yeah, I agree totally 100%.
Okay, awesome. Yeah. So I want to move into a conversation about recurring pregnancy loss. Before I do that, I wanted to just ask about one other thing. So one thing I like to look at, and I don't know if this is something that you look at as well, but like cervical mucus patterns. Do you look at cervical mucus patterns? Yeah.
Yes, I think they are so, so interesting. It's kind of really beautiful what the body can tell us.
Oh my gosh,
Cervical
yes.
mucus for me is like, I love it better than BBT. Controversial, but I do.
No, I think I would agree with you. Yeah.
Yeah. Yeah. I'm finding that, I mean, for me, I am at the point now, I have been on my journey for quite some time. It's been almost 5 years since I started,
Mhm.
really digging deep and learning a lot about this. And now, I know when I'm in my fertile window, strictly by my cervical mucus, I don't really pay that much attention to my BBT at all,
Mhm.
but that's, just the relationship that I've developed with my body. So
Yeah.
trying to get my clients to kind of cultivate that same relationship and really be tracking the patterns versus, them trying to kind of work with me to decode their chart, but they haven't even been tracking cervical mucus. So it's like, I feel like I'm kind of flying blind almost, there's so much information that it can tell us. And then, layering in certain questions if there is, some sort of weird pattern with BBT or cervical mucus. And it's like, okay, well, what was kind of going on at that point? What are you currently going through? Like, how was your, any changes in hydration, any changes in diet, stress, all the things. So, yeah.
Yeah. I've talked a little bit about this in like other videos of mine, but I specifically look for like a double peaks, right? Like, are you getting
Mhm.
cervical mucus that's like fertile, like slippery, stretchy, clear, more than once throughout the cycle, like with a gap of time in between? Are you getting
Mhm.
like just an excessive amount of peak type cervical mucus, which many people would celebrate because I think that they would assume that it's a good sign. You've got a ton of peak type cervical mucus. It's like 10 to 12 days worth. But in fact, like, and I don't know if you agree, Carrie, but in fact, that could actually mean quite the opposite, right? That you're not fertile or that you're, not ovulating. Maybe you've got something like luteinizing unruptured follicle syndrome and just being like really wet feeling all the time, but not necessarily producing a lot of cervical mucus. Those I know from like Napro tech. I don't know how much you dabble in that or if you know like at all, but those I know are patterns to kind of keep our eyes peeled for.
Yeah, and I'm also thinking too, at that point, especially when there's, a lot of women are, saying, well, I have, maybe a couple dry days in my entire cycle. That being a red flag as well. Versus, I know there's plenty of my clients who like wish they could say that because they just don't even, they can't even, they feel like they don't even experience cervical mucus at all. But, I guess the extremes, right, are, any side of really anything. We kind of want to be like in the nice sweet spot in the middle, not too far out either way, but specifically with not have any not having any dry days. I'm thinking too of like ectropion cervix and anything else that could be kind of a clue there to why that's happening. But yeah, the excessive cervical mucus always gives me pause as well, as which is it's so helpful because I feel like especially with endometriosis, there's so many symptoms that could be a symptom, that could not be a symptom, but we have been really, really trying to be the ones who it's our job to at least flag that for you, your job to sit with it, feel like if that feels right for you, and then start advocating for yourself to possibly get diagnosed. Um, because, I would be so upset if someone 4 years ago thought that about me, and I had spent 4 years trying to conceive and having recurrent loss, and perhaps it was due to a structural issue such as endometriosis that was playing a role that I beyond structure, but including structure, um that was playing a role and kind of harming my chances at overcoming loss. So we really try and be the ones who are like, look, here's what we're seeing. Here's what it could mean. It doesn't necessarily mean that, but let's have this discussion.
Yeah. Take the information so at least you're informed, and then, run with it.
Yeah.
Action, like take action on it or not, but it's good to have that information. I totally agree with you.
Yeah.
Okay, so recurring pregnancy loss. This is, one of the things that you specialize in. What are some common themes here, or common causes of recurring pregnancy loss, if there are some obvious ones that you're seeing in practice?
Yeah. So I kind of like to think about them in buckets. So, of course, there's going to be foundational work, nutrition and all of the things. But
Mm-hmm.
when it comes to recurrent loss, it is more complex. There are, it's not just let's clean up your diet and take a couple of supplements and we're good to go. There's some buckets I think that's worth exploring. And so when I get a client with recurrent loss, these are the buckets that I'm thinking about and kind of going through, seeing what's really kind of going on there, which buckets need support and which don't. Not every bucket does. So first one is definitely thyroid, like I had mentioned earlier. Even if it's normal now, what is it doing in pregnancy? Is it trending towards abnormal now before pregnancy? Let's kind of turn that around. So in there, I'm looking for, hyper and hypothyroidism. Um, and for thyroid, the first trimester has such a strain, and there's another big strain around 15 weeks. So let's really try to, especially with early losses, let's make sure that thyroid was feeling supported, um, or understand if it wasn't feeling supported before we kind of really dive into the other buckets. Two is immune, like we also had mentioned, overactive, especially if your immune system is for whatever reason recognizing that pregnancy as a threat. um, we want to kind of figure out how to calm that down. Same with underactive, to conceive, to for implantation to happen, the immune system does ramp itself down. So if you're already low and going lower, it's kind of a problem. We still want you to be at a sweet spot. So we want to definitely make sure that you're supported. With gut health, what happens in the gut doesn't stay in the gut, because the gut and the reproductive organs are neighbors. So we do want to be looking into things like dysbiosis, leaky gut. If you've were someone who's had, traveler's diarrhea 10 years ago and think that, it might not still be affecting you. It might, and it could be affecting fertility and pregnancy outcomes. So again, a huge piece of the immune system, but also inflammatory process as well. Next, I'm really looking at cellular, and I would say cellular health more than necessarily egg health, because I really want the mitochondria to be fired up, right, and supported. I want to be thinking about potentially any oxidative stress that could be going on in the body from inflammation, figure out where that could be coming from, and also supporting specifically like the cell membrane. So making sure that as those cells divide in pregnancy, that they are dividing in a healthy way and doing what they need to do. And so, just supporting that process ahead of time, making sure we have the right nutrients on board for that, I think can be very, very helpful. Um, Structural. I'm always thinking structural. Endometriosis, of course, endometritis, so inflammation or infection of your uterine lining. Um, let's get that biopsy. Let's rule that out, or treat it if it is an issue, because a lot of times it's asymptomatic. Fibroids, polyps. I'm also very, very, very supportive right now of vaginal microbiome testing. I think that BV specifically is something that is surprisingly can be asymptomatic, even though as women we are told, it's like if you have a fishy smell, if you're noticing watery discharge. I think that there's biofilms that are forming that are just very, very prevalent and kind of tricky to kill off. So getting that vaginal microbiome testing, I really love the company Evie. I use it myself. I have definitely had issues in my last pregnancy. I could not kick BV for the life of me. I had to do, unfortunately, so many antibiotics that I really did not want to do. But for me, I had my son, my first child. Um, I had him early, so preterm labor, and I really think that was a strong part of it, of going into labor early. And I just, with my history of loss, was like, this is the price I'm going to pay to stay pregnant and make sure that this factor is not going to affect me. So I do think that it is more prevalent than we realize, and playing a role in recurrent loss. And male factor, because of all the things I just mentioned, that's all great and we can work on your body, but that is only 50% of the equation. We have to look into sperm health, specifically with one miscarriage, with multiple miscarriages. I want DNA fragmentation to be done. Let's see what's going on. Let's support his body, his oxidative stress, because ultimately, as I'm sure, your listeners have heard, is, sperm is a reflection of his overall health. So that's a downstream product. That's kind of, imagine if we could, like, our eggs came out every month in a form that we could just like pick them up and test them for quality, but we can do that with men. So let's do that and make sure that his body is supported the very best way possible, and that we can give, his side of the equation a fighting chance as well. So those are my main buckets that I'm thinking of. Again, on top of what are we doing for sleep? What are we doing for, under eating? What are we doing for metabolic health? How are we supporting the nervous system?
It was a really comprehensive list. I love that. Under the like immune umbrella, celiac, just again in my population, just because we know that these other autoimmune conditions can be a bit more common in the endometriosis population. But otherwise, I thought that was really, really comprehensive. I love that. Love that you brought up the vaginal microbiome. Love that you brought up the male factor. That's very, very personal to me. So yeah, really comprehensive list. Now, I'd love to make these videos actionable. I do want to preface by saying, for anybody who is watching, that obviously, like, you're going to have to be independently investigated, right? You're going to want to do the testing that kind of is most relevant for you. But some of these things, Carrie, that you mentioned, like I do a lot of vaginal probiotics. I do a lot of work on the gut. Like, that is huge. I'm so glad that you brought that up. There's some like really interesting research too that's come out recently on Helicobacter pylori and infertility and subfertility. So that's super interesting connection as well. A lot of like blood sugar balancing. I do look at the hormones. I think they're super relevant, especially in endo, like DHA for egg quality and, pre-peak estradiol. And then of course you alluded to early on the progesterone and the luteal phase to sustain the pregnancy, the thyroid, all those great things, the unsexy basics as they're called, the sleep, the stress management, the movement, all that stuff is so, so, so important. I do a lot of like trying to optimize cervical mucus. We do like the autoimmune and like fertility focused, like the natural killer cells, the Th1, Th2 ratios and things like that. So some of these things we can act on in the case of like, taking something to support cervical mucus, vaginal probiotics, pre and probiotics, diet tweaks for supporting the microbiome. What about things like, so I guess two-part question. One, is this kind of in line with the types of things that you do in practice? And then two, for some of those things that are maybe a little bit more advanced, like, somebody who might require intralipids or steroids, or maybe it's a structural issue and they need surgery. Are there things that you work on in practice that, clients can still do outside of these like prescription medications, more advanced therapies, or something like surgery?
Yes, yes. So I think definitely, I think that the way I kind of love to approach even how I structure my protocols is, here are the issues that I'm seeing. Here are the testing options that could potentially give us more information or fill in gaps of things that we don't know yet. Here is what I'm thinking our care team needs to look like. We're part of it, as well as the conventional side, who can do those advanced testing or give you the medications, as well as on our end, working on the dietary lifestyle and supplement, as long as it works with the medication, to, reduce inflammation, support the immune system, support thyroid. So I definitely think that there is a lot of overlap there that, I mean, the way I approached my own journey and the way that I like to approach it for my client is you can get the best of both worlds. Like, let's get the best of functional, let's get the best of integrative, let's pair it with the best of conventional so that you have like the whole picture. And so, what we call that is clarifying your story. And so, really getting clear on what needs to be supported, and let's figure out the best way to support that, whether it is strictly with medicine for you. If that's what you want to do, fantastic. There's other things that we can be doing to support and work around that medication. Or if you wanted to do, just supplemental, great, but we might still need to be getting some other labs or some monitoring, for example, from your fertility clinic to kind of understand like what your body is doing and what this process looks like. I can't tell you from your chart what your lining looks like if it's optimal for implantation, for example. So I do think that really kind of clarifying for people what their care team is, who's managing what, who's responsible for what, is very clarifying. I have had so many clients who their thyroid medication is being managed by their fertility clinic. And while I love that they are being hands on with that, you are only with your fertility clinic here for about 8 weeks. And then who is managing it? You're in pregnancy, you're supposed to test your thyroid about every 4 weeks to make sure that your dosage is right because it might fluctuate. You might need to go up or down. And so I have seen so many people, especially with recurrent loss, kind of slip through the cracks on these things. So I just think, having someone on board like us to kind of think through those steps is so, so powerful. Um, but yes, to answer your question, I do think that supporting on both sides. So for example, doing some, taking gut health, if you, well, I guess that's not a great example because it's not like the clinic's going to give you some sort of medication for gut health. But thyroid, so is a great one. So, if you need thyroid medication or, but, we can be working on making sure that you're getting the nutrients to really support that conversion of T4 to T3 if that is your kind of thyroid pattern of, thyroid dysfunction. For, intralipids or prednisone and these immune cases, if we can be kind of working on our end to figure out, well, what is triggering your immune system? It's wonderful that you have medication to kind of ramp that down, but why was it turned up? Like, let's look into that. Let's kind of consider, is it an autoimmune thing? Is it food triggers? Let's kind of do that work on our end so we can at least take that out. I mean, that was a huge part of my journey as well, as food sensitivities and food triggers and overactive immune system, and kind of really calming that down before trying to conceive again.
I'm so glad you brought that up. I totally agree with you. And that's definitely the same sort of
Mhm.
steps that I would be taking in practice too with clients who have this sort of pattern of an overactive immune response. I love doing the allergen panels for sure, and not the IgG. I know some practitioners love the IgG. I'm not a fan. I'm not a fan. I don't know, Carrie,
Yeah.
if you agree with me, but I'm not a fan.
I think you have to take them with a pretty big grain of salt. So,
Right. Yeah.
uh, why spend your money?
Yeah, yeah, yeah. But no, I love that you're like, I love everything you're saying, and I totally agree with you 100%. You gave some great examples there. And I think really at the root of what you're saying is even if this is a more advanced issue that absolutely requires medications, whether that's lit therapy, whether that's intralipids, whether that's steroids, whether that's blood thinners, like whatever it is, there's probably something you could be doing from sort of a diet, lifestyle, maybe supplement perspective that's going to support that anyway, right? Absolutely. Like if you've got something going on with your immune system, the large majority of your immune system lives in the gut. So if you spent the first 10 years of your life taking antibiotics 3 times a year, absolutely that's going to affect the way that your immune system functions, right? So and we know that sleep is extremely profound for immune function. So I totally kind of get the gist of what you're saying there. That no matter what it is, we can still support it in natural ways.
Absolutely. I mean, at the
Mhm.
end of the day, the medication is wonderful. And the way I kind of frame it for my clients is, we don't have to shy away from medication, but it really
Mhm.
does truly depend on your timeline. If you want to take a little bit more time to do more of the unsexy basics, we can and make some progress. But I mean, I get it. The age gap between my children was like an extreme motivator for me, and devastating that I couldn't really control it. So if you do want to turn up your timeline a little bit faster, let's do that medicine and also support it on the back end so that long term we have a really good grip on what your body might be doing and what support it might need before and after pregnancy.
Love that. I love that. Can you share with our listeners, where they can find you if they're like, oh yeah, this was amazing. I relate to a lot of this information. So just a little bit about where they can find you. And then if you had any kind of final thoughts for anybody who's watching, who's maybe finding themselves in this cycle of recurring pregnancy loss or being told that they're sort of an advanced case, maybe they'll require some medication. So just final words and, where our listeners can find you.
Yeah, so I am one of three. I work with Olivia Mitchell at Your Fertility, Your Future on Instagram. You can find me, Functional Fertility Coach, on Instagram. And my other partner, Kaylee, is incredible, amazing gut health expert.
Mhm.
She is Functional Fertility Research on Instagram. So that's the three of us. You can find our website, yourfertilityyourfuture.com, and there's links to learn all about each of us independently. We all have different strengths and expertise, which is the fun part about working with us. We kind of like to pair you who you're best matched with versus just, you coming to me. I obviously do a lot of the miscarriage stuff, but if you were PCOS or autoimmune or gut health, go with Kaylee. Completely unexplained infertility, go with Olivia, or depletion, go with Olivia. And if you're trying to navigate clinics, you can look back to me. So we're really pretty fluid, but that's where a little bit about where you can find me.
Awesome.
I think something that I was just talking about this with my partners is um, early on in my case, I definitely thought that I was not a complex case. I thought, well, if I can just do these couple of shifts, learn about my cycle, learn about my body, no big deal. Um, I was able to get pregnant, I was not able to stay pregnant. And so what I think I wish that I had learned, 4 or 5 years ago is that I am a complex case. I do need a little bit more support, and that's not a bad thing. It just means that don't pour, make sure that your foundation is strong, but don't just stick there. Work with someone who can kind of help you clarify which of these buckets you really need to focus on and put some energy into supporting, because that's going to go a long way. And definitely don't feel like you need to do all this trial and error yourself. Listening to all the podcasts and seeing all the things on TikTok and trying them all, taking all those trending supplements, it's a lot. It's going to feel very, very heavy. And just feel free to put that down and give it to someone like us, who we do this day in, day out, and want to simplify and streamline it for you and get you to your goal as fast as possible with the least amount of steps in between, because they're personalized, targeted to you and what your body needs. So even though you are a complex case, even though you have had recurrent miscarriage, if you've made it here, I'm assuming that you have, please know that there are people out there who just want to help you and want to help you get there as fast as possible.
Yeah, love that. I think that's a fantastic way to end off. And I'll just add to, like, I'm sure Carrie, both of us, and the other partners on your team probably have tons of miraculous stories of how, it just took investigating this thing, or like one of my like all-time favorite testimonials is a client of mine who was having recurring losses and ended up testing positive for celiac disease, and just working on her gut health and optimizing all of that resulted in her becoming pregnant, naturally sustaining that pregnancy. And now she has a beautiful baby boy. And I'm sure you have tons of examples like this. I'm sure your other, members of your team have examples like this. So yes, even if you're told that you're a tricky case, or whether or not you've been told, there is hope for you. Don't give up. You deserve comprehensive care and investigation. And that can absolutely lead to motherhood and becoming a parent. And so, yeah, I totally, totally agree with what you said.
One other thing I'll share is, I was working with a fertility clinic and they weren't very integrative, but I have the knowledge on my end to do my half of that stuff. And so I had done a couple IUIs, and I had tried letrozole, and they were like, we're kind of getting to the point where you haven't had any success. And so you might want to be thinking about IVF. And at this point, like based on our statistics, you probably have a 6% chance of trying to conceive, or of conceiving naturally. And 6 weeks later, I conceived naturally and carried to term. So, don't fall for the statistics. I think that they are very helpful in kind of framing out expectations. There's definitely a time and a place, but you are not that number. Your chances are very different. That number, I don't know who that number is based on. We don't know what those women's bodies were like and what they were going through. So you're your own person. This is bio-individual journey. And I believe in you.
Yeah, likewise. I think that's a beautiful, beautiful spot to end off. Thank you so much for watching today's interview. If you enjoyed it, please give this video a like and hit that subscribe button, and I will see you in the next video.